Good morning friends. Welcome to Bone Doctor. Today we are going to discuss very important topic of osteoporosis. As we know, as decades and centuries pass, the number of adult population or persons who are more than 60 years old, elderly population, that is increasing day by day. So, this aging population is going to suffer from a geriatric problem, that is osteoporosis. Now, why osteoporosis is so important a topic? Osteoporosis is a silent thief, as we say it, because as a person, a man or a woman becomes old, her bones become very weak, the calcium content in their bones decrease rapidly, and that makes their bones very fragile. Fragile bones are a cause of bone pains, and most importantly, they cause fractures in our vertebra, fractures near our hip joints, fractures near our wrist. These fractures are extremely painful and causes a lot of disability in the old population. They are very hard to treat, they are very costly to operate. So, it is best to understand about osteoporosis and treat them as much as possible so that we can prevent such pain and fractures in the elderly population. So what happens in osteoporosis? During osteoporosis, as the patient, as a man or a woman, age crosses 50 years, 65 years, the calcium content in their bone decreases and the overall structure of the bone, as if you have seen the structure of the bone has a woven structure, means it has a net-like structure. The density of that net-like structure decreases with age, and in elderly age it almost becomes half of what he or she used to have during his younger age. This is what we know as osteoporosis. What is the grading, or how do we measure osteoporosis? Osteoporosis is graded or compared by observing a group of bone densities of young age population of 25 years of age. We take it as the standard bone density which a person should have. Of course, the bone density decreases days as it passes. If a person has a bone density less than 1 standard deviation to minus 2.5 standard deviation from that density, normal density, it is said as osteopenia. If the person has less than 2.5 standard deviation of density as compared to the mean of the young age population of that area, we claim it as osteoporosis. And if that person suffers from a fracture, then we call it an osteoporosis with a fracture. So this is how we grade osteoporosis. Do watch subsequent videos where I will discuss how we diagnose osteoporosis, what are the types of osteoporosis, and how we treat osteoporosis. So all for now.